Okay, I hope everybody enjoys the video.
Yeah.
And I'm going to pronounce some of these words for you, and hopefully I get them all correct. I'm going to start with liability and the sign or symptom of exaggerated changes in mood. So like the word libel or liability, that is like exaggerated changes in your mood. 1 minute you're very quiet and the next minute you're all happy. So it's just a quick change in your moods. Ataxia, lack of muscle control and coordination. And you've seen people with that, especially when they're walking with a cane or something. Sometimes they don't have a lot of control or coordination. Let's see. Otorrhea, and that is the ear discharge. Tinnitus. Tinnitus is ringing in the ears, and you can't assess it in someone else. They have to tell you they're having tinnitus. Dysphagia, so difficulty swallowing, dysphagia. Gingivitis. Gingivitis is a gum inflammation. Ataxia, that EPI, ataxia, the nosebleed. Rhinorrhea, running of the nose. Let's see what this one is. Okay, palpitation is something else is that you can feel it. So it's a palpitation of the heart. Precordium, and that's just a region in front of the heart. Adventitious breath sounds. So that's anything that are abnormal, adventitious. And then you have jugular vein pulsation. So both of the words are of pulsation, the carotid artery and the jugular vein pulsation. And then hypertrophy, meatus.
What about meatus?
Meatus, external acoustic meatus.
It must be something different.
It's like the opening. Any type,
Opening.
any meatus, like you have the urinary meatus,
Mm-hmm.
so any opening, meatus. Mm-hmm. Scaphoid, ascites. So like ascites would be any, like not any bloating in the belly, but a larger amount of fluid collection, ascites. Distension, bloating, a feeling of bloating. Flaccidity, flaccidity is like a floppy limb, like if you have a stroke, one side is very flaccid, just loose. Hemophilia, it's paralysis on one side of the body. I think I should say that hemiplegia, so it's half paralyzed. Graphesthesia. I think graphesthesia is how you say this word. Graphesthesia. Like if you put in a paper clip in the hand and you'll feel it. So the graft, the beginning. So a graft and a feeling. Graphesthesia. Ability to recognize, like writing on the skin or a sensation or touch. That's the definition on here. So I guess you would, like if you closed your eyes and you wrote an S on your hand. Proprioception. Proprioception. I'll be in a minute.
No, I don't need you. I was just going to have them come in here.
Okay. Proprioception is being aware of body movement. So again, if you have a stroke, somebody's hand could be very paralyzed and it would be in the spokes of the wheelchair and they wouldn't even know it. So it's a sense of where your body is. Spasticity. So the muscle is very spastic. So like if you ever
Like a
work out
spasm?
too much and the muscle twitches, That's what they're talking about there. Bronchial, the small passages. Alveoli. That's, definition there. Dyspnea, or difficult labored breathing. Respiratory excursion.
What's that?
Movement of the chest, so like, and that's the movement of the chest. I did that one. Okay. Erythema is a redness of the skin, usually in patches. Urticaria, that's where you, hives or itching. Some people say urticaria with just a rash, but that's the type of rash. Confluent, running together, confluent. Papule, patch.
Can you just give briefly?
Sure. You really should memorize these, but a papule appears as a direct result of a disease process. Papule is the area of the skin or tissue. It says here less than a centimeter around. A papule has a distinct border and appears in various shapes. Papules are often called skin lesions, which are essentially changes in color or texture of the skin. Sometimes papule cluster together to form a rash. And then patch, to me, patch and papule are very similar. Plague or plaque, I think they would say maybe, plaque, is a larger superficial bump, and it's elevated. So maybe that's why they're talking about a plaque. Wheal, W-H-E-A-L, wheal, and they're talking about more of a hive, but it's definitely a raised area. Like when you have a TB skin test and you see that little bubble, that's what's called a wheal. Nodule, small bump. Yeah, see, all those really run together. Tumor, vesicle, bulla. It's a large fluid-filled bubble that's superficial. It says superficial or deep. So more like a blister. I very rarely ever hear them call that. I think blister is more the terminology. Pustule is a pus-filled bubble. Pustule. Cyst. Now, cyst and pustule, a cyst is more to me like when you get a burn and then you have that bubbled area where there's fluid underneath there. Again, important to remember these terms, so I'm just kind of giving you my interpretation of it. Corn, it says the second is a soft corn, like a mole, I don't know about this one. Yeah, I would read on this one, corn. Excoriation. To me, excoriation is like a very intense diaper rash or like a urine burn on an elderly patient. Excoriation, so it's more than erythema, where erythema is red. Excoriation is a deeper red to me. Again, like a urine burn or a very intense diaper rash. Petechiae is like, the word ecchymosis describes red blood cells that are outside the vessel wall. Petechiae almost looks like a rash, but it's red in pinpoint areas on the skin. Petechiae. And then ecchymosis is a discolored skin caused by bursting of capillaries. And that's, again, right underneath the skin. Okay. Rebound tenderness. Rebound tenderness also called the Bloomberg sign, is where you're not really going to be detecting that. It's more like for a doctor, but if you read it, you kind of have to understand. So like my example of rebound tenderness would be if you have an appendicitis and you push, it doesn't hurt when you push because most injuries will hurt when you push. It's when you let go, that's when it hurts. So it's kind of rebound, it's opposite. So normally you push on an injury, ooh, that hurts, it hurts. But with like an appendicitis, you push and it doesn't hurt. But when you let go, for some reason it hurts. Okay. Arcus senilis is, it appears a white or gray blue ring or arc around the cornea of the eye. Intropan, a condition that causes your eyelid to turn inwards. So just look at the prefix of that, intropan, and then ectropan is turning the eyelids outward. And then exophthalmos, abnormal protrusion of the eyeball. And you get that during Graves' disease. I don't know if you've ever seen that picture in they usually have a picture of that in your health assessment book, where the person has very large eyes and they're pushing. They feel like, it looks like somebody from behind them is just pushing their eyeball out. Meiosis, and that's where your pupil constricts, meiosis. Oh boy, I don't know if I can say this one. Mydriasis, dilation of the pupil. Strabismus, I don't know if I said that word. Let me get right. Strabismus.
Strabismus.
Failure of the two eyes to maintain proper alignment, working together as a team. So if you were doing like a physical assessment on somebody and you had a pencil and you bring that pencil close to them, both of your eyes are going to track that pencil close to you. And then when you move that pencil away, both of the eyes will move away. Or they're working as a team without moving your head, your eyes are turning. This is if you have this, the eyes are not working together. One will stay here and one's going to track. Not good. It's a failure of the two eyes to work in alignment together. Puncta. This test be used, I'm not really sure of this one. Pupil are equal, round, reactive to light. It's used with the PERLA acronym. And ptosis, when an upper eyelid droops over the eye. Ptosis. I think that's it.